Hello, my name is Vivian Gibson, and I'm the host of the Circle of Hope program, along with Dolores Thompson and Lisa Davis. Today we'll be talking about a very serious condition that we have here in Mississippi and other parts of the country. Our guest today is Dr. Robert Evans, and he's an endocrinologist here in Jackson.
Thank you for having us.
We're more than happy to have you, Dr. Evans, because diabetes is a very serious condition that the country has to face. Can you tell us exactly what diabetes is?
Simply speaking, diabetes is a disorder where our blood sugar or glucose is too high. Classically, the forms of diabetes are type 1 or juvenile diabetes that usually strikes children and young adults, where you absolutely run out of insulin. But the more common type 2 diabetes is much more complex and is related to being overweight and over a period of time not making enough insulin.
Can it be prevented?
It can be prevented. Type 1 diabetes is usually not preventable, unfortunately. They're working on many different ways to try to identify it early and prevent it. But type 2 diabetes can gratefully be prevented or delayed, mainly by good diet, keeping your weight at an ideal body weight, and by exercise.
Are we seeing an increase in juvenile diabetes?
Juvenile diabetes is actually increasing a bit, but unfortunately we're seeing more type 2 or adult type diabetes in juveniles.
And what can we do about that?
It's a big problem. It ties in with the problem of childhood obesity or lack of exercise or over intake of calories. But it mainly comes down to, in the pediatric ages, again, good diet and plenty of exercise.
So when a person has diabetes and they're not in an area underserved to get treatment, how does that work? Do they just continue to live with it?
A lot of people have diabetes and never know it, and unfortunately go several years without diagnosis. And that is a problem in underserved areas. It really is. And unfortunately, they often come to medical attention when they present with a complication of diabetes, such as an infected foot or kidney problems or eye problems.
You know, growing up myself, I grew up in the country, and I didn't know anything about diabetes because many people in the community, they would say sugar, and I guess I just really didn't know what the sugar was, and it was just last 20 years that I found out more information and was able to really comprehend what these people were going through with.
Yes, it can be very complicated and complex, unfortunately. When we think of diabetes, in my view, it's more than just the blood sugar. Unfortunately, it's high blood pressure that often accompanies it. It's high cholesterol that often accompanies it. It's the vascular disease that often accompanies it, including heart attacks and strokes, and then kidney failure and blindness and nerve problems in the feet. And unfortunately, these individuals over a long period of time have to deal with these problems.
In my family, I had 2 individuals who died from complications of the disease. So is it is it disease or the complications that come with the disease?
In 2012, it's usually the complications. That if your blood sugar goes up to quite a high level, it's usually treatable and you get it down fairly well and usually is non-fatal. But it's the long-term complications that cause the mortality and morbidity.
Lisa?
What are some of the signs that a person could have, not knowing they have diabetes, but some signs that you can get to tell someone that you need to seek medical attention?
Certainly. The signs involve fatigue. High blood sugar makes you tired, gives you a dry mouth, makes you thirsty, and makes you go to the bathroom. So that if you have to get up at night to urinate 4 or 5 times during the night, then yes, you need to be checked for diabetes. Many people also lose weight in the initial phases of type 2 diabetes or type 1.
Well, I had a friend who would just sit at his desk and fall asleep.
Yeah.
And we knew something wasn't right.
Yeah.
And when they made him go see the doctor, they found out that he had diabetes.
Sure.
But one of my concerns is for my children. They have an abundance intake of sugar.
Mm-hmm.
And like Vivian was saying, you know, we hear the word sugar, so we kind of relate it to diabetes. Could my kids' sugar intake cause them to have like juvenile diabetes?
Not juvenile. They could be at risk for type 2 or the adult type diabetes that we see in some juveniles. Type 1 diabetes or juvenile diabetes is an inheritable disease. Usually it's strongly inherited within certain families that have certain markers for the disease. It can be sporadic, however, and it's due to antibody production in your body of antibodies that actually go to the pancreas and kill the cells that make insulin. So intake of sugar does not really cause that particular diabetes. It can lead to type 2 diabetes, however.
Do you think, go ahead, Sue.
Dr. Evans, as we're gaining this knowledge that we're gaining about this diabetes, what can we do to help others that may not know about diabetes and exactly what it is? What can we do to help them as far as giving information?
Spread the message that it's out there. It's increasingly common, and it's in my family, on both sides of my family. And just spread the message that if you're beginning to feel badly or you have particular symptoms that I mentioned, yes, seek medical attention. And in general, just in our lifestyle, everyday lifestyle, try to exercise, try to walk as much as we can rather than take the car, and just try also to keep our weight as good as we can.
Is it important for us at this point to, because it seems to me like it has become an epidemic, and is it important for us to, as we're sharing the information, to let them know it's just not something to take lightly because it is an epidemic that's spreading through not just Mississippi but the nation? Absolutely.
I'm glad you used the word epidemic. In the United States, there are probably 25 to 30 million diagnosed diabetics. There are probably 75 million who fit into a category called prediabetes. And so that's essentially a third of the population of the United States. And it is an epidemic. It's 12% of the population in Mississippi already, and probably more. But it is an epidemic.
Okay, thank you so much.
Actually my brother-in-law had diabetes, and he died from it. So we're trying in the family to educate about diabetes, because I think in the country areas, and they may be still calling it sugar and may not take it as serious as it actually is.
Absolutely.
So I think we have to not spread this word around here. I think the way we could make a difference is get out in the neighborhoods where, again, people are just not taking it serious and just saying sugar. And I feel like we really owe that.
Yes,
too.
Absolutely. In the initial phases of diabetes, it can be handled fairly routinely, and people tend to be lulled into a false sense of security. However, as the years roll by, you are much more prone to specific complications of diabetes that I mentioned.
Yeah, well, I had an uncle who actually had a wound that would not heal. And we see people having their toes and different parts of their bodies cut off. What causes the wound not to heal, with this disease?
It's very complex. The higher the blood sugar is, then the white cells of the body don't work very well. But in the setting of long-term diabetes, you often have vascular disease where enough blood does not get to the particular wound for it to heal up.
And that's very serious. That is it. But how does it get there? Is it just it's just something that happens?
It's a very insidious process over a long period of time. The glucose molecules themselves end up harming the proteins of the body and inducing a lot of chemical changes that occur within the vessels and the protein structures. So over a long period of time, for instance, cholesterol blockages can develop, the arteries can become stiff, the skin itself can become stiff. And in the setting of poor nerve function, then often a wound is developed, and the patient, due to bad nerves in the feet, for instance, may not have the same pain response that you or I would have, and therefore the wound can be...
Hold that thought, Dr. Evans. We're going to go to a break, but we'll be right back. Dr. Evans, as we take a break, I want you to continue your information for us.
Indeed. What happens over a long period of time, the glucose itself damages the blood vessels, also contributes to cholesterol blockages in the blood vessels, also damages the peripheral nerves, so that a mild wound that we may incur on our foot is not perceived in the same fashion that a non-diabetic would have, and so that it is non-painful. And unfortunately, many diabetic patients might walk around on a large ulcer on their foot, never feeling pain. And by that time, it becomes quite infected, and unfortunately, amputations can occur.
Wow. So this wound, what have you, could be happening in your leg, and you don't have a clue.
Exactly. We try to teach our patients to look at their feet every day. It's a simple thing to do, but can pay quite a bit of dividend. And know that if you have a blister or a callus that looks like it's breaking down, by all means seek medical attention quickly. Don't take it for granted, because it can get very bad overnight, in fact.
Do you think clinics, that since it's so bad here in Mississippi, do you think we need to possibly set up centers in communities to treat diabetes?
I think that would be wonderful. I think that it's a good model for chronic disease management, and I think it would be a wonderful thing to do.
And also preventive.
Yes, and at the time of clinic visits, do preventive care.
I think that if other communities would come together, it would probably solve some of the issues, and diabetes can be more, diabetes can just be recognized for what it is, and it's a very dangerous disease to have. And I think if communities come together, we can get that message out there. And I do believe that we're going to have centers, because it's such a large population of people with diabetes. I do see centers going in that community and actually helping those people to understand and get treatment for diabetes.
I agree. It's much easier to prevent the complications than treat.
And we're at what, do you know the percentage here in Mississippi?
In Mississippi, it's conservatively about 12% are diagnosed.
And then there are those who aren't.
And there are those that are not diagnosed, and then a large category of what is referred to as pre-diabetes, people who are going to be prone to it in the future.
And I think, too, Lisa had spoken about her sons. I think maybe when conferences and family reunions, that we play a health bring in a health program within all the activities that go on, and be able to see who has diabetes, because in some cases it's hereditary. So if they could plug that into the festivities, then that would help, because they could look at grandma had diabetes, mama had diabetes. I think that would help as well in terms of a community that's coming together.
Absolutely. Great idea.
Yeah. Dr. Thompson, you were telling me about someone up in Pickens and the percentage. I believe you want to do something there in Pickens.
Yes, I do. I'm an information person, so I'm the type, once I get some information and I feel that it can be very helpful to someone else that may need it and not know they need it, just to help them get a better understanding. So once I'm getting this information, I want to go out, especially in my hometown, and share it, because I do know quite a few people that are, as a matter of fact, in my own family, that have diabetes. And I feel like the more information that people can get, the better they can help themselves and help others.
Absolutely.
And I do have a question, Doctor. When someone is first diagnosed, of course we know to tell them to seek medical help or medical attention, but should we tell them that perhaps they need to talk with someone, perhaps a therapist or a counselor? Because I believe that depression could set in once they're diagnosed?
Yeah, many people who face diabetes also get depressed. I mean, it's a daunting task. Take medicines, watch what you eat, prick your finger to check your blood sugar. It can be very frustrating and often lead to depression as well. And the more coping skills, the more problem-solving skills we develop, the better we're going to do with diabetes.
So we could safely say that depression is related to
Can
diabetes.
be, yeah.
Okay.
Dr. Evans, I want to ask you another question that I read and want to know if it's true. If a pregnant person has gestative diabetes during their pregnancy, they have a 50% chance at getting diabetes 20 years later.
Correct. It's probably even higher than that, perhaps 60%. But that's very true.
Right.
And if you have a baby that weighs over 10 pounds, then you've had gestational diabetes.
Oh, wow. Dr. Evans, I want to thank you so much for coming on our show today. You've given us some great information, and we are like a crusade here. We want our program to be one that will reach out and help others. So we thank you so much for coming on.
Thank you for having me.
Thank you.
Thank you, Dr. Evans.
At this time, we have another doctor that's going to give us some information about diabetes, and his name is Dr. Wilson Perry. Dr. Perry, thank you for coming on the show.
Oh, thank you for having me.
Dr. Perry, you gave me a tour of the dialysis center about 2 months ago because I wanted to see what people with diabetes and kidney failure go through, and I was just amazed, and it's just amazing that to see all of those individuals with the blood coming through, and I'd never seen anything like it before.
Well, dialysis is truly life support for those people that have to live that way. Unfortunately, diabetes is the #1 cause in the state of it. I understand that diabetes is a topic today, so it's one of those situations we'd like to avoid in most of the population, and they can do so much to avoid it by education and by tight sugar control and by seeking out the health services that are available.
Now, did you say sugar intake?
I'm saying type 2 diabetes is probably the major cause of loss of kidney function in the state of Mississippi at this time.
Okay, tell us what kidney failure, how would a person get to that point?
Well, kidney failure by itself is a silent killer. You don't know that your kidneys are failing, okay? Diabetes, usually around year 15, you'll start to see some of the side effects of long-term diabetes. And those manifest themselves by spilling a protein in the urine. You can get all sorts of vascular disease related to diabetes, whether it be cardiac or peripheral vascular disease, The kidney is just another vascular organ in that train of that triad of disease that diabetes attacks and kills. And it's usually around that 15th year that all the complications really start hitting home. Now, most people may be diagnosed late, and that's a problem in this state with late diagnosis of diabetes. And so, ideally, we would have people being diagnosed earlier. We'd have a stronger education program out there that would be making it more on people's minds so that they take the initiative to go get checked. There are screenings that they can go to across the state that the Diabetes Association puts on. It would be great if we had a active statewide educational program for people to seek out early education for these health problems that are silent killers. And by the time they get to me, it's too late most of the time.
Wow, so we need, as a community, to get out and spread the word and try to prevent this having to go into dialysis and kidney failure.
Absolutely.
What are the symptoms of kidney failure and having the diabetes and kidney failure and not know it?
Well, initially, in terms of progressing to end-stage renal disease, the symptoms are that of depression, actually. It's sometimes hard to decide if somebody's depressed or if they have uremia related to the loss of their kidneys. And that may be the only symptom that's there. Swelling of the feet, though. Diabetics can spill lots of protein and can develop edema and swelling that is difficult to control. They may have gone into the hospital with congestive heart failure. They may be a diabetic, and they may have underlying kidney disease that's not picked up at that time because no one thought to screen their urine for protein in it. A simple screening test can make all the difference in the world.
One thing that sticks out in my mind when my mom was going through kidney failure and dialysis was her doctor always told her to remember the creatinine level.
Right.
And a lot of people don't know anything about creatinine level.
That's a great question. We get asked this all the time. What is creatinine? And creatinine comes from muscle. Without getting into too much detail, it's an energy molecule. Creatinine is a widget for us. It gets filtered by the kidneys, and it's something that we can measure fairly cheaply, and it's something that gives us an idea of how well the kidneys are filtering a product. Okay. The higher this number in your bloodstream, the worse your kidneys are filtering it. You think of your kidneys as nothing but a coffee pot filter, making coffee, and say you put coffee in the filter and you run water through it, and what comes out is water but no coffee. Well, it's not filtering out the coffee that you wanted to make.
Okay, we're going to take a break. We'll be right back. Okay, Dr. Perry, we have another question for you.
Oh, sure.
Yes, Dr. Perry, I would like to know that once the people are diagnosed with diabetes, and of course they end up having to be dialyzed, is it the same for each person as far as the days that they have to go and the amount of time? Is it the same for each person?
No, the prescription for how long they have to be on the machine is different for each person.
Okay.
Generally speaking, though, your kidneys work 24 hours, 7 days a week. It takes 3 days out of the week for about 4 hours at a time to go through a dialysis session. This may vary by 30 to 40 minutes depending on the person, but we try to at least dialyze somebody 3 days a week.
Thank you.
What is the longest time that a person will spend in dialysis?
In terms of their
Days.
in terms of days, we're currently work on a 3-day schedule, 3-day-a-week schedule right now for people. So Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday schedule is how most people dialyze.
Okay. Dr. Perry, we want to thank you so much for coming with us today. You had to take your time off, and we just thank you so much. Okay, we hope you enjoyed our show today. So watch us next time. We'll be back real soon. Thank you.